A very good afternoon and welcome to our session on the topic
Yeah,
IVF.
good afternoon.
We are glad to have Dr. Sunitha among us today to help us understand the topic. The doctor will take us through that more and more in the session today. So be there till the end of the session. If you have any doubts, any queries, stay tuned and post your comments because the doctor will be taking your questions at the last. So just be there and have a good session. Ma'am, you have the stage now.
Yeah, thank you. Good afternoon, dear friends. Welcome back to another Facebook Live session from Apollo Fertility. Um, this today's session is a very important topic for any fertility specialist and for the patient also. It is about in vitro fertilization. So now I think it's in vitro fertilization has been a mode of treatment for all our infertility patients since 40 years. It's been there, and slowly and surely we have progressed a lot from the time where the results of this treatment was only 15 to 20%, and now we are um at a stage where we can tell the patients that they have about 50 to 60% of chances of conception with the IVF treatment. So that is the progress we have made in terms of the laboratory conditions, in terms of the advancement in terms of medication, the protocols, and here I would like to happy to say that all the units of Apollo Fertility have the state of the art IVF labs with their own uh, protocols which are individualized for the patients so that we can give maximum success rate for our patients. Okay. So, what we have realized in our day to day practice uh, dealing with fertility patients, that IVF treatment, patients seem to hesitate uh, going forward with this treatment, especially. There are a lot of misconceptions regarding this treatment. They One is, of course, lot of the patients think that this procedure is very painful. There are a lot of side effects, and also the other very major misconception is that the babies born through the IVF treatment may not be normal. So these are some of the misconceptions which I would like to clear during this session. And the other very important thing is a lot of them do not seem to understand the exact procedure that is involved in an IVF. So a lot of patients who are planning to go forward with IVF treatment, or your doctors would have advised you IVF. So I think this session will be very useful for those patients who want to clear their doubts in terms of what the treatment process is involves. So, going ahead, so first of all, let us see what are the indications for this treatment. So, just let us first initially let's go ahead and see what actually happens in a natural fertilization process. So, every month, a woman who is having a 28-day cycle, one mature egg gets released around the day 14 of her cycle, which is picked up by the fallopian tube, and the egg and sperm meet in the tube, and this is where the fertilization happens. And this fertilized egg, which slowly starts growing and becomes a blastocyst, and then it finally reaches the uterus and where it gets implanted. So this is what a natural fertilization that happens in a woman. So, in an IVF cycle, this procedure gets replicated in the laboratory. Now, what are the indications for an IVF? There are various indications, and some of the very common indications here would be any problem in the fallopian tubes. Your fallopian tubes may be blocked due to some infection, or there's a condition known as endometriosis, which affects the ovaries and the fallopian tubes. And in this condition, patients seem to have difficulty in conceiving, and it's also a condition where you may be having very limited reserve or very low reserve, and you do not have enough time to wait. In those patients also we do suggest IVF. and of course advanced maternal age where the fertility comes down drastically, or previous fertility treatments, simple treatments like an IUI which has not resulted in a conception, then that case IVF is advised. Of course, then there is of course a male factor where very low sperm count or low motility or very low count. Then we also do what is the procedure known as the ICSI, which we will discuss at the later point. Now, it's very important that if your doctor has advised you IVF, the cycles prior to the IVF treatment, it's important that you take a healthy, balanced diet. And if you're having unhealthy habits like smoking or alcohol, or you are a person who's taking excess of caffeine, it's important that you stop all these unhealthy habits in order to achieve maximum success rate in your IVF cycle. And if you happen to be overweight, then excess body weight, obesity does impact in the IVF cycle. Studies have shown that obesity itself can have an impact on a woman's fertility. They seem to have lower oocyte quality, and IVF cycle success rate may get hampered because of the high BMI. So it's important that if as a patient your BMI is not ideal, that you lose weight before planning for IVF treatment. And stress, adequate having an adequate sleep is also equally important. Lot of times we have realized that these days the patients do not seem to have adequate sleep. Sleep has become a major issue. Lot of the couples seem to work late nights. They do not sleep on time. They do not sleep. Seem to have their diet on time. All this will adds up to the fertility issues, and that can impact your IVF cycle. So also do remember that if your doctor has advised you certain medication, make sure that you take those medications on time so that your IVF cycle goes well. Now coming to the steps that are involved in an IVF cycle. So the first, usually in the clinic, what we ask, we generally advise our patients to come on the first or second day of their menstrual cycle, where we do an ultrasound and blood tests. And once we are comfortable with the scan findings and the blood test reports, then we start our gonadotropin injections or the IVF injections, uh, which are started on the second or the third day of the patient's menstrual cycle. These injections are basically hormonal injections, which are FSH and LH. These gonadotrophins are normally present in the woman, which make the woman ovulate every month. But these levels of these hormones are much lower in the woman in a natural cycle, so that only one egg develops. While in an IVF cycle, we would like to have multiple we would like to have multiple eggs develop. So these injections are given to in order to make these eggs grow. The next step would be monitoring by ultrasound and hormonal tests. The third step would be collecting the eggs which have grown. The fourth step would be making these eggs and sperm get fertilized in the embryology lab and culturing it for 3 to 5 days. And the final step, the most important step, would be transferring these embryos into the uterus. So, as I already spoke to you, so when we start you with the IVF injections, these injections are usually given on a particular time of the day, and it's important that the patients take the injections on that particular time. And usually, we ask in our clinic, we request the patients to come to the clinic for the injections, but some of them can be self administered. These injections are not very painful, mind you. You do not have to worry about that. And when we give these injections, it's important that we monitor the progress of your egg growth. through ultrasound examination and by the hormonal tests. And we will be doing it probably every 1 or 2 days in order to assess the overall progress, so that either we may be tweaking your doses, either we may decrease the dose or increase the dose depending on your progress, or we may continue with the same dose. So, so this is how, so in a natural cycle, only one egg develops, while in an IVF cycle, we are targeting at developing multiple eggs, and these injections last for about 10 to 12 days. So this is how the ultrasound picture looks like in an IVF cycle patient. So uh, the whole idea of giving these injections is to make ensure that they develop multiple eggs. So if you are a low responder, if you are having a low reserve, you may develop less number of eggs. If you are a normal responder, you may develop around 8 to 9 eggs. And if you are a high responder, you may develop around 20 eggs also. So it is these injections will ensure the growth of the eggs which are already there, but they will not be able to create new eggs. So once these eggs are ready, then we give an injection known as the HCG, which is the trigger injection. And once this injection is given, we ask the patient to come to the clinic 34 to 35 hours later for a procedure known as the egg collection. The egg collection is a daycare procedure. So a lot of times patients are concerned like what happens during the procedure. Is it going to be very painful? Rest assured, it's not a very painful procedure. It is done under anesthesia, so you will not know the pain. And it involves a procedure which is done transvaginally, like how we do the ultrasound. Through the similar route, we will be doing the egg collection. So, the ultrasound probe, which is used to visualize your ovaries and measure the follicle sizes and the egg growth, through to that ultrasound probe, there is an option of attaching a needle to the probe. So, through the vagina, we will be able to look at the ovary and go where exactly your eggs are growing and then collect by pricking on this ovary. There will be one prick, and through that one prick, we will be able to collect all the eggs in that ovary. So it's a small procedure. Patient usually comes in the morning and will be able to leave by afternoon on the same day. So there's no admission required. So once these eggs are collected, the next step would be we will give these eggs which are collected to the embryologist. So the embryologist will be examining these eggs under the microscope. They will evaluate the quality of these eggs, the maturity of these eggs, and they're segregated into three categories: either very immature, uh, or very very immature, or slightly immature, and the mature oocytes. So the mature quality oocytes are the ones which will are very useful for us in resulting in a pregnancy, while the immature, which is known as the GV or M1 oocytes, may not be helpful in for us in the IVF cycle. So this is how they look under the microscope. So once these eggs are uh, uh, scanned under the microscope, at the same time, we ask your husband to give his semen sample. And in the lab, what is the conventional IVF, which is in vitro fertilization, in a petri dish, we are going to keep the oocyte and we are going to put all the sperms around the oocyte, and we'll let the sperm enter naturally into the oocyte. That is known as the in vitro fertilization, where we where the sperm enters naturally on its own into the oocyte and gets fertilized. While there is another procedure in the lab that is done, which is known as the intracytoplasmic sperm injection, where in each of the mature oocyte, the sperm is injected under the microscope after carefully selecting the healthy sperm. and this is known as intracytoplasmic sperm injection. This is a procedure which is an advanced procedure in the lab. It's done by skilled embryologists, and this is especially needed for male factor infertility where the men has very low sperm count, very few motile sperms, and sometimes it is also can be done for men who do not have any sperm count, and then we do what is procedure known as the TISA or TISA procedure or PISA procedure, where we directly go into the testes, take out those few sperms which are available there, and then do this procedure, which can again help us in achieving a pregnancy for the couple. So once these uh, eggs are collected and the sperm is injected into the egg, or they may be placed around the egg, as I said, in an IVF procedure. These eggs are then placed in the incubator. Now incubator is very very important in a lab, because this place, the incubator, is something which is similar to our body. The conditions, the environment, the media, the air, everything is similar to how it is in our body. And that is why in this place the oocytes tend to start growing and multiplying and become multiple cells. So by day 3, the egg, which is only a single cell, now becomes around 6 to 8 cells and becomes what is now known as an embryo, or a day 3 embryo, which we say in scientifically. Here, now at this stage on day 3, the cells would be around 6 to 8 cells. And these are now segregated into A grade, B grade, and C grade, depending on how the embryos look under the microscope. The top quality or the A grade embryos have a better success rate compared to the ones which are having a lesser quality. And if we have uh, many of these day 3 embryos, say around 6 to 8 day 3 embryos we have on day 3, then we may also extend the culture to 2 more days and grow it for another 48 hours, which is known as the blastocyst culture. And this embryo, which is on 6 to 8 cell, will become much more bigger and will look like this. This is known as the blastocyst. Now, again, this blastocyst is again graded into A grade, B grade, C grade. Now, the top quality are the A grade embryos. The top quality embryo will have a better success rate as compared to the B or C grade blastocyst. This top quality A grade blastocyst have about 60 to 70% chances of conception. Yeah. So once these embryos are ready, we will be calling the patient. We will be doing an ultrasound examination to see whether the endometrium is thick enough for us to transfer these embryos. And then under ultrasound guidance, it's a very very simple procedure where we, under ultrasound guidance, we visualize where the uterus layer is, and then with a small catheter we load these embryos into the catheter, and under ultrasound guidance we put this catheter into the endometrial layer and place them in the correct position. uh, See, this is this is your endometrial layer, and this is where the embryos are placed in this picture, as you can see. So again, a very simple procedure. It takes about 10 minutes. Does not require any anesthesia. It's done on ultrasound guidance. And once these embryos are placed, 15 days later, you will be we will be doing a pregnancy test to understand whether whatever procedure has been done is successful or not. And uh, uh, and in case, of course, if it is positive, well and good, we will be continuing the medications. And in case for some reason it is negative, then we also can go ahead and in case the surplus embryos are there with us and they are stored, then we can go ahead and do a frozen embryo transfer. So, this is how the IVF procedure is done for the patients. Now, of course, all of us know when things go right, we are not worried. But sometimes when things go wrong, we are worried, we are concerned, we'll have lots of doubts about why it happened to us. So I thought let us also see how things can go wrong in an IVF cycle. So sometimes in the clinic we may stop the injections midway. We've given injections for say 5 to 6 patients, and we have realized that the response is not adequate. Patient is not getting the adequate response. She's not developing the eggs which we expect her to develop. So in that case, sometimes occasionally we may cancel the patient, and then we may ask them to come back in the next cycle, and we may give a little higher dose so that we get the response which we are looking for that particular patient. Also, occasionally, if there is a very hyper response where too many eggs are developing, which is generally when we see the patient, we understand what dose to be given. But yeah, occasionally it can happen if the patient is a polycystic ovary patient, there can be a hyper response to the drugs which are given. In that case, we may not be doing the embryo transfer. All the embryos may be frozen and they will be transferred in the next cycle in order to prevent what is known as ovarian hyperstimulation syndrome, which can be life threatening for the patient. So, these are the precautions that are taken in any good clinic in order to uh, be safe for the patient. Of course, occasionally, very, very rarely, it can happen that uh, none of the eggs which have been retrieved are fertilized at all. So, in that case, there's failed fertilization. None of them have become embryos. So, this can also happen occasionally. But yeah, so when this happens, of course, we will not be able to do the embryo transfer. Then we have to look into what could be the possible reason for this, and then accordingly plan for a second cycle with a change in medication and probably some changes in the lab also, and probably investigate a little more. Probably genetic investigations also may be required whenever there's a failed fertilization to understand how best we can help this patient. And it's also possible that everything went well, we've got fantastic oocytes, we have done our IVF procedure, and then we land up with bad quality embryos or embryos which have not grown at all and which stop growing after 2 days. Then in that case, we may not be able to do the embryo transfer. So these are some. Sometimes in a few patients we can have this sort of situations, and in that case we should not get disheartened. We can always plan for a second cycle, do the required changes in terms of the protocol, in the lab, whatever changes have to be done needs to be taken care so that we get a better outcome for the patient. So, what are the factors that can affect your IVF success rate? Of course, all of us know age of the patient is the most important. If you're less than 35 years, you have a higher success rate. Oocyte quality matters. The better quality oocytes, they have better success rate. The sperm quality also equally matters. The infrastructure in the clinic, the lab infrastructure, the experience of the clinician, all this will affect your IVF success rate. Now, coming to some, let us look into some of the frequently asked questions or doubts by the patients who are planning to go for an IVF. So, one very important thing is IVF safe? Yes, the treatment has been there with us since the past 40 years. It is a time tested procedure, it is safe. Uh, of course, when done in a center which is having the required infrastructure and the experience, it is definitely a safe procedure. The other important question that a lot of patients ask is, are babies born through IVF normal? So, yeah, babies born through the IVF are normal, and the risk of having an anomalous baby will depend on the age of the patient, and the risk is similar to natural conception. It is not increased because of the IVF procedure. And a lot of research and data shows us that IVF babies are normal. Coming to other important question patients ask us is, what is the success rate of IVF? Yes, we are worried about the success rate. So, yeah, so in any good clinic which follows all the protocols and has the required infrastructure and a skilled embryologist, the success rate would be around 40 to 60%. A lot depends on the patient's age, the protocol used, and the laboratory conditions. Lot of patients do ask us, is the egg retrieval very painful? Yes, you can have mild pain like your menstrual cramps, but nothing very severe. So usually, this after the egg retrieval procedure, patient will be able to do their own work, simple small works they can easily do on the same day itself, and the next day they can probably even go back to work also. So, does IVF injections have side effects? Yes. So, this is another very common question we get. No, there are no side effects with IVF injections, and a lot of studies have been done on this. Of course, the number of IVF cycles that a patient can go is limited. You cannot do many number of IVF cycles. So, in the clinic, we keep around 3 to 5 cycles is our maximum number of cycles which we do for the patient. We don't go beyond that because right now we do not have data on what could be possibly with the side effects of IVF injections. So since we do not have uh, much data on the side effects of IVF, it doesn't mean we can't keep on doing IVF cycles for patients. So we do have to keep our number of IVF cycles limited. So in the clinic, we keep around 3 to 5 cycles as our uh, uh, number of cycles which we do for our patients. So the other question is, which is commonly asked by our patients, is, will I put on weight after IVF cycle? So no, there's. I don't think in our experience also, we have not seen patients putting on weight after IVF. So a lot of times is what happens is post IVF, and especially if the woman has become pregnant, she tends to take more rest. She tends to eat more, and that is the reason for putting on the IVF, putting on weight after IVF. It's not because of the procedure itself. And do you need to have bed rest after an embryo transfer? No, you don't have to have bed rest after the embryo transfer. You can go back to work, uh, especially if it is online work. Then definitely you can go ahead. And even if you have to go back to your office, also that is also you can go ahead and start working after the embryo transfer. So, another very important question patients ask us, is there any special diet to be followed during IVF cycle? So, the only thing we advise our patients is you take the balanced diet, which is rich in fruits and vegetables and nuts. That's all you need to do. You don't have to take any special diet for the IVF procedure itself. So yeah, friends, I've tried to explain the IVF procedure in the simplest possible way. Try to clear the doubts that usually patients have whenever they're going for an IVF treatment. So hope it was useful, and meet you again once again in another Facebook Live from Apollo Fertility. Bye. Take care.